Good morning everyone. Today I will be talking about imaging and pain neuroimaging in temporomandibular joint disorders. What are the various imaging techniques used for TMD disorders? Out of which I will be discussing only 4 today, rest 4 will be taken up in the next seminar. So coming to the overview of what is TMD disorders and what is the characteristics of pain and what neuromechanisms are involved, I want to give a short overview and then come to the main imaging systems involved in TMD disorders. So coming to the definition, temporomandibular joint disorders are a group of more than 30 conditions that cause pain and dysfunction in the jaw joint and muscles that control jaw movement. Prevalence, according to one study, the overall prevalence of TMD disorders was approximately 31% of adults and elderly population and 11% for children and adolescents, and most prevalent TMD disorders was with displacement with reduction. Types, there are 3 types, which are muscular, structural and acute. What are the characteristics of these 3? Muscular issues are the most common type of TMD and are caused by tightness in the muscles or stiffness when someone masticates. Typically, a patient experiencing a muscular disorder will notice pain in the front of the ear or pain when chewing. This problem often comes on suddenly and can be related to stress also. Structural, coming to it is kind of a degenerative joint disease where the severe type of TMD is often caused by structural changes in the jaw. This can result in teeth shifting to the left or right or the occlusional changes and the way the upper and the lower jaw align, that is the occlusal alignment. The result is intense pain when biting or chewing. To properly diagnose degenerative disc disease, the patient must have both an MRI and CT scan performed. Acute, the third and the final type of TMD disorders is acute and it is trauma related. This can be a result of a sports injury or a trauma like a car accident or a blunt force acting on the face or the chin. The result is damage to the TMD structures and acute inflammation in the body is present. Clenching or grinding of the teeth can also occur as a part of this acute type of TMD disorders. Coming to the characteristics of pain, how the pain will be perceived and what will be the signs and symptoms. Pain in the chewing muscles and or the jaw joint, it is the most common. Pain that spreads entirely to the face and neck. Jaw stiffness will be there and limited movement of the jaw and locking of the jaw can also be present. Painful creaking, propping, grating of the jaw joint will occur and ringing in the ears is the most common sensation. Hearing loss and dizziness can also be a factor, and a change in the way the upper and the lower teeth fit together, that is the occlusal alignment, will be seen. Coming to the neurobiological mechanisms, what all neural pathways will be involved. So it will be involving the nociceptors, peripheral sensitization as well as the central sensitization. Role of the emotional and cognitive factors will also play a role in pain perception. In the journal club, the characterization of the emotional and cognitive factors I will be discussing today. So coming to the main topic, what is the functional imaging systems used in TMD, what are its objectives and the 4 types that I will discuss. First, functional imaging, what are the objectives? Study the pain mechanisms in the central nervous system, map altered brain activity and the connectivity in the TMD patients and assess the effectiveness of the interventions or the therapy that we give. These are the objectives. And what are the brain regions in the TMD that will come into play when the functional imaging is done. First, somatosensory cortex, S1 and S2. It will be processing the sensory aspects of pain. The anterior cingulate region, ACC, will be involved with the emotional and the motivational dimensions of pain. The insula part of the brain will help in interoception and the pain intensity, and specifically the homeostasis will be balanced by it. The prefrontal cortex, the cognitive modulation of pain can be seen, and in the amygdala, fear and anxiety related to pain can be seen. So coming to the first modality, the simple basic one, panoramic radiography used in dentistry. So it shows the jaw and the joints and the associated structures. It is a helpful tool for a clinician or a dentist to identify any periodontal or odontogenic causes of orofacial pain. Only the lateral part of the condyle is visible, ma'am, here, and and this is a limitation because there will be superimposition of the zygomatic arch and the base of the skull. So what panoramic radiograph helps in? It helps in evaluating the degenerative bony changes. Only in the later stages of the disease can be it can be done. Asymmetries in the condyles, hyperplasia and hypoplasia, trauma and tumors can be seen in panoramic radiography. Coming to the second part, panoramic radiography does not reveal the functional status of the jaw joint and has relatively low specificity and sensitivity when compared with CT, CBCT and MRI. It is only useful for detecting bony changes of the condyle, but when these changes are suspected and the radiography is normal, then we will use CT and CBCT. Coming to the second, the CT, it was first used for evaluation in TMJ disorders in 1980. CT is considered to be the best method for assessing osseous pathologic conditions. It allows a multi-planar approach which is having the sagittal, coronal and the axial views of the TMJ structures, obtaining 3D images in closed and open mouth positions. Signs of degenerative changes can be seen in the joint like surface erosions, osteophytes, remodeling, subcortical sclerosis, articular surface flattening can be also evaluated using CT. Changes in the shape and the location of the condyle and the loading zone can also be seen. And see the main radiological axis for investigation for tumors, growth, development anomalies and fractures. Basically, any CT examination of the TMJ should focus on the following: whether the cortex is intact, normal size and the shape of the condyles are present or not, and their centered position in the fossa, the adequate joint spaces, centric relation and the loading zone. In one of the papers by Westenson et al. Found that 75% of the sensitivity and 100% sensitivity for the diagnosis of the condylar bony changes using CT. Regarding the visualization of the soft tissues in the TMJ, that is the disc, synovial membrane, ligaments and the muscles, CT is not used as a primary diagnostic tool. The disc could be visualized on CT scans only with injection of contrast media with the loading of ink and imaging of the joint, that is known as arthrography. Coming to the main advantage of CT, it is high. Main disadvantage of the CT, it is of high cost and high radiation exposure is there. So CBCT, seeing these disadvantages, CBCT was introduced in the industry and it is widely available now and provides high resolution multiplanar reconstruction of the TMJ. The main advantage of the CBCT compared to CT is here the radiation dose is lower compared to normal CT scans. And in a review published by Sylvia et al. Pointed out the main contributions of CBCT in the field of TMJ. It allows calculation of the volume and the surface of the condyle, improves quantitative analysis of condyle surface and allows detecting the mandibular condyle shape, improves the accuracy of the linear measurements of the mandibular condyle, and in case of facial asymmetry, if it is present, the condyles are often symmetric while joint space changes can be seen between the two slides, so we can distinguish between them, and clarifies also the position of the condyle in the fossa. But it has limitations also. The simple one is the projection of the artifact, which can appear due to the patient's accidental movement during the imaging and examination, and also a decrease in radiation dose can affect the image quality. Coming to the third one, MRI. Overview of MRIs in TMDs. It is a non-invasive imaging modalities, provides high resolution of images and surrounding structures. It is a gold standard for imaging TMJ disc morphology and position. Applications: detecting TMJ disc displacement, with or without reduction, identifying degenerative joint disease such as osteoarthritis, identifying the inflammatory conditions such as synovitis and capsulitis, soft tissue evaluation, also evaluation of the articular disc, retrodiscal tissue and the joint capsule, and changes in the synovial fluid, that is effusion. Functional analysis, assessing joint movements and dynamic MRI scans, tracking disc movements and joint mechanics. It can be also helpful in pre-treatment assessment in as establishing a baseline for treatment planning and determining the severity of the structural damage. Advantages, it is for the superior soft tissue contrast compared to CT or X-rays. No ionizing radiation exposure is there, provides detailed information on disc position and joint morphology, and capable of detecting early joint degenerations. Limitations of MRI, high cost and limited availability, time consuming procedure, and requires patient cooperation so that the motion artifacts could not be visible, and it can also affect the image quality, contraindicated in patients with implants and various pacemakers. Coming to the last one, that is the high resolution ultrasonography. What is the overview and how it is used in TMD disorders? It is a non-invasive imaging modality which uses high frequency sound waves to visualize the TMJ structures. It will give the real-time assessment of both static and dynamic features of the joint, increasingly used as a cost-effective alternative or complement to an MRI. You can use like MRI also and high resolution ultrasonic radiography, sonography also. Applications for visualization of the soft tissue, that is the articular disc position, synovitis, joint effusion and capsulitis. For dynamic evaluation of the movements during jaw opening and closing, it can also be used, identifying disc displacements and joint mechanics. And muscle and the ligamental analysis can also be done, detecting abnormalities such as muscle hypertrophy and myotrophy, and monitoring progress. Any progress related to joint pathology during and after treatment, it can be done. And advantages, it is non-invasive, safe and radiation-free technique, portable and cost-effective. Real-time imaging can be done, suitable for assessing superficial joint structures. Limited ability to visualize deeper joint structures such as the condyle morphology. Operator-dependent results require skilled technicians, inferior to MRI for detailed evaluation of articular disc and retrosternal tissues. Reduced accuracy for osseous defects and abnormalities. So coming to the conclusion, in these four, the selection of the proper radiological technique for TMJ is needed, for as well as the cooperation of the patient must be there to carefully correlate with the clinical signs and symptoms of the TMD disorders. The purpose of the chosen radiological investigation must improve the diagnosis and the treatment outcome. That should be the outer goal. Now, the CT and the MRI nowadays are the most used imaging techniques. As discussed, CT is most efficient in the examination for the osseous changes, whereas the MRI remains gold standard for articular disc examination. High resolution ultrasonography is a potential promising imaging diagnostic technique in imaging for TMJ disc position. Thank you.